Hey Alpha Nurses, I'm Licensure from alphanurseguy.com. This is 15 practice questions. With out the way, let's get started.
The nurse in the emergency department is preparing to administer alteplase to a client whose initial symptoms of a stroke began 2 hours ago. Which interventions should the nurse implement? Select all that apply. 1. Check the client's armband for allergies. 2. Check the results of the client's CT scan of the brain. 3. Teach the client this medication dissolves clots. 4. Dilute the medication with normal saline and administer over 2 minutes. The correct answers are 1. Check the client's armband for allergies, and 2. Check the results of the client's CT scan of the brain. Rationale: the nurse should always check the client's armband prior to administering medication. There are 3 types of strokes: thrombotic, embolic, and hemorrhagic. The nurse must know that the client has not had a hemorrhagic stroke before hanging a medication that destroys clots. Administering alteplase, a thrombolytic medication, to a client who has had a hemorrhagic stroke can result in the client's death. Teaching the client can be done after the medication has been administered. Patient teaching is generally secondary to the immediate, life-saving administration of this time-critical drug. Informed consent is necessary, but detailed teaching can wait until the drug is safely infusing or later, and the patient may be too acutely ill or neurologically impaired to fully grasp the information at the moment of administration. The client is having status epilepticus and is prescribed IV diazepam. The client has an IV of D5W 75 milliliters per hour in the right arm and a saline lock in the left arm. Which intervention should the nurse implement? 1. Dilute the diazepam and administer over 5 minutes via the existing IV. 2. Do not dilute the medication and administer at the port closest to the client. 3. Question the order because diazepam cannot be administered with D5W. 4. Inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. The correct answer is for inject 3 milliliters of normal saline in the saline lock and administer diazepam undiluted. Rationale: the nurse should administer the diazepam, a benzodiazepine, undiluted through the saline lock. Diazepam is oil-based and should not be diluted. It should not be administered in an existing IV line if another option is available. The nurse does not need to question the order because there is an existing saline lock. The client diagnosed with a stroke has been prescribed phenytoin. Which statement explains the scientific rationale for prescribing this medication? 1. The client's stroke was caused by some damage to cerebral tissue. 2. The stroke caused damage to the brain tissue that could result in seizures. 3. Hemorrhagic strokes leave residual blood in the brain that causes seizures. 4. This medication can help the client with cognitive deficits think more clearly. The correct answer is 2. The stroke caused damage to the brain tissue that could result in seizures. Rationale: stroke caused loss of function in areas of the brain leads to a problem with nerve impulse transmission. This blocked transmission can initiate a seizure. Phenytoin is an anticonvulsant. Strokes cause damage to the cerebral tissue. The brain does not cause the damage to itself. If the client survives a hemorrhagic stroke, the body will reabsorb the blood. There should not be any residual blood. Anticonvulsants do not increase cognitive ability. The nurse in the ICU is caring for a client diagnosed with a left cerebral artery thrombotic stroke who received a thrombolytic medication in the ED. Which intervention should be implemented? 1. Administer oral ticlopidine. 2. Place the client in the Trendelenburg position. 3. Keep the client turned to the right side and high Fowler's position. 4. Monitor heparin infusion. The correct answer is 4. Monitor heparin infusion. Rationale: ticlopidine, an antiplatelet, may be ordered in the future once the cause of the thrombus is determined, but this would not be ordered in the ICU. The Trendelenburg position is head down and would increase intracranial pressure. There is no reason to restrict the client to lying on the right side, and high Fowler's is sitting upright. This would be a difficult position for the client to maintain. The client should have the head of the bed elevated approximately 30 degrees to decrease intracranial pressure by gravity drainage. The anticoagulant medication heparin is administered to prevent clot reformation after lysis of the clot by the thrombolytic, and its infusion should be monitored. The client newly diagnosed with a seizure disorder also has type 2 diabetes. The HCP prescribes phenytoin for the client. Which intervention should the nurse implement? 1. Instruct the client to monitor his or her blood glucose more closely. 2. Explain that the phenytoin will not affect the client's anti-diabetic medication. 3. Discuss the need to discontinue oral hypoglycemic medication and take insulin. 4. Call the HCP to discuss prescribing the phenytoin. The correct answer is 1. Instruct the client to monitor his or her blood glucose more closely. Rationale. Serum glucose must be monitored more closely because phenytoin may inhibit insulin release, thus causing an increase in glucose level. Options 2 is not a true statement. Diazepam may affect the client's anti-diabetic medication. Option 3 is not a true statement. The client can still take oral hypoglycemic medications. The nurse should call and discuss any questionable medication with the HCP, but there is no reason to discuss diazepam, a benzodiazepine being prescribed for a client with type 2 diabetes. The nurse is preparing to administer an oral medication to a client diagnosed with a stroke. Which intervention should the nurse implement? Select all that apply. 1. Crush all oral medications and place them in pudding. 2. Elevate the head 30 degrees. 3. Ask the client to swallow a drink of water. 4. Have suction equipment at the bedside. 5. Insert a nasogastric tube to administer medications. The correct answers are 1. Crush all oral medications and place them in pudding, and 3. Ask the client to swallow a drink of water. Rationale. Some medications can be crushed and administered in pudding if the client has difficulty swallowing, but the nurse needs to be aware that enteric-coated or time-release medications should not be crushed. The client's ability to swallow must be assessed before attempting to administer any oral medication. Water is the best fluid to use because it will not damage the lungs if aspirated. The head of the bed should be elevated to 90 degrees when the client is swallowing food or medications. Equipment is usually charged to the client. The nurse should first determine if suction equipment is needed prior to setting it up. The client's medications are being administered orally. Therefore, the nurse should not insert a nasogastric tube. The female client diagnosed with epilepsy tells the nurse, "I am very scared to get pregnant since I am taking medication for my epilepsy." Which statement is the nurse's best response? 1. You are scared because you take medication for your epilepsy. 2. Can you tell me more about what is concerning you? 3. You should not get pregnant when you are taking anticonvulsants. 4. Have you discussed your concerns with your HCP? The correct answer is 2. Can you tell me more about what is concerning you? Rationale. Option 1 is a therapeutic response that is used to encourage the client to ventilate feelings, but the nurse should provide factual information to this client. The nurse should explore the reasons for the client's fears in order to be able to give her information that would help her make a decision about becoming pregnant, as many anticonvulsant medications have teratogenic properties. A female client with epilepsy can give birth to an infant without epilepsy. The client should discuss a potential pregnancy with a significant other, but this is not addressing the client's concerns. The long-term care facility nurse is caring for a client diagnosed with a cerebrovascular accident 6 months ago who has residual cognitive deficits. The HCP has ordered alprazolam to be administered at bedtime. Which interventions should the nurse initiate for this client? Select all that apply. 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. 3. Administer the medication at 2100. 4. Administer the medication with a full glass of water. 5. Do not administer if the client's apical pulse is less than 60 beats per minute. The correct answers are 1. Offer toileting every 2 hours. 2. Move the client close to the nurse's station. And 3. Administer the medication at 2100. Rationale. Alprazolam an anti-anxiety medication, has a side effect of drowsiness, which is why the HCP chose this medication for the client, to help the client rest at night. The client has cognitive deficits and should be on fall precautions. So it is hoped that assisting the client to the bathroom every 2 hours will prevent the client from falling while trying to get to the bathroom. The client at risk for falling should be as near the nursing station as possible. This allows the staff to keep a closer watch on the client. The medication is ordered for bedtime, usually 2100 in most healthcare facilities. Giving the medication with a full glass of water would increase the client's need to get up during the night to use the bathroom, increasing the risk of falling. This medication does not require the apical pulse being monitored prior to administering the medication. The nurse is caring for a client diagnosed with a hemorrhagic stroke. Which medication should the nurse question administering? 1. Clopidogrel, 2. Mannitol, 3. Nifedipine, 4. Dexamethasone. The correct answer is 1. Clopidogrel. Rationale: the client has experienced a bleed into the cranium. Clopidogrel, an antiplatelet, interferes with the client's clotting ability. This medication should be held and discussed with the HCP. There is no reason to question giving a medication that will decrease intracranial pressure. Mannitol is the diuretic of choice for this client. It is an osmotic diuretic, which has the best effect on the cranial tissues. Nifedipine is a calcium channel blocker that will decrease the client's blood pressure, which is elevated in clients with increased intracranial pressure. Dexamethasone, a glucocorticoid, will decrease edema, resulting in decreased intracranial pressure. The client newly diagnosed with epilepsy is prescribed an anticonvulsant medication. Which information should the nurse tell the client? 1. The medication dosage will start low and gradually increase over a few weeks. 2. The dosage prescribed initially will be the dosage prescribed for the rest of your life. 3. The HCP will prescribe a loading dose and decrease dosage gradually. 4. The dose of medication will be adjusted monthly until a serum drug level is obtained. The correct answer is 1. The medication dosage will start low and gradually increase over a few weeks. Rationale: anticonvulsant dosages usually start low and gradually increase over a period of weeks until the serum drug level is within therapeutic range or the seizures stop. It is incorrect to state that the dosage prescribed will be the dosage for the rest of the client's life, but it is correct to state that the client will most likely be on the medication for the rest of his or her life. The medication is started in low dosages and gradually increased. The dose of medication will be adjusted until a serum drug level is reached, but it will be more frequently than monthly. The elderly client diagnosed with a stroke is being discharged. When preparing the discharge instructions, the nurse notes many medications that are ordered to be taken at different times of the day. Which intervention should the nurse implement first? 1. Complete a comprehensive chart for the client to use. 2. Refer the client to a home healthcare agency for follow-up. 3. Teach the client to return to the HCP office for follow-up. 4. Discuss the multiple medications and times with the HCP. The correct answer is 4. Discuss the multiple medications and times with the HCP. Rationale: the client has had a stroke and may have difficulty complying with multiple medications and different administration times. Research indicates that the fewer medication administration times during the day, the better the compliance with taking the medication as ordered. The nurse should discuss simplifying the medication regimen with the HCP. Option 1 could be done if the nurse and HCP cannot simplify the medication routine. Option 2 need to be done based on the nurse's evaluation of the client's situation, but it is not the first intervention. Option 3 should be done, but it is not the first intervention and does not address the problem of many medications and multiple administration times. The nurse is preparing to administer phenytoin IV push. The client has an IV of D5W0.45 normal saline at 50 milliliters per hour. Which intervention should the nurse implement? 1. Administer the phenytoin undiluted over 5 minutes via the port closest to the client. 2. Dilute the medication with normal saline and administer over 2 minutes. 3. Flush tubing with normal saline. administer diluted phenytoin, and then flush with normal saline. 4. Insert a saline lock in the other arm and administer the medication undiluted. The correct answer is 3. Flush tubing with normal saline, administer diluted phenytoin, and then flush with normal saline. Rationale: phenytoin cannot be administered with dextrose because it will cause precipitation. Phenytoin should be diluted in a saline solution, and the IV tubing should be flushed before and after administration because a dextrose solution will cause drug precipitation. There is no reason for the nurse to cause more pain to the client by starting a saline lock because the IV tubing is already in place and can be flushed before and after the administration of phenytoin. Anytime a nurse administers an IV push medication, the nurse should dilute the medication. This causes less pain for the client, helps prevent infiltration of the vein, and allows the nurse to administer the medication over the correct amount of time if it is diluted to a 10 milliliters bolus. The client diagnosed with chronic hypertension is prescribed furosemide and enalapril. The client's blood pressures for the last 3 weeks have averaged 178/95, and the HCP has added atenolol to the client's current medication regimen. Which statement is the scientific rationale for including this medication in the client's regimen? 1. Achieving a lower average blood pressure will help to prevent a stroke. 2. The other medications are not effective without the addition of atenolol. 3. The atenolol will potentiate the effects of loop diuretics. 4. The HCP will taper off the enalapril and eventually discontinue it. The correct answer is 1. Achieving a lower average blood pressure will help to prevent a stroke. Rationale: hypertension is a risk factor for developing a stroke. Some clients require multiple medications to control their hypertension. If option 2 was true, then atenolol would be the only medication the client needs. Beta blockers are frequently used in combination with other antihypertensive medications to control a client's blood pressure. Atenolol, a beta blocker, does not potentiate the effectiveness of loop diuretics. Beta blockers, not ACE inhibitors, enalapril, must be tapered off when discontinuing them to prevent rebound cardiac dysrhythmias. The HCP is adding the beta blocker to the current medications. The 55-year-old African-American male client presents to the emergency department with blurred vision, slurred speech, and left-sided weakness. The client has a history of hypertension and benign prostatic hypertrophy. Which statement regarding the client's medications should the nurse ask at this time? 1. Have you been taking over the counter herbs to treat the BPH? 2. Do you take an aspirin every day to prevent heart attacks and strokes? 3. Do you eat green, leafy vegetables frequently? 4. Have you been taking medications routinely to control the hypertension? The correct answer is 4. Have you been taking medications routinely to control the hypertension? Rationale: many medications for hypertension have the adverse effect of causing erectile dysfunction, which many men are hesitant to discuss with their HCP, and a man may simply stop taking the medication to avoid the side effect. The nurse should assess how the client has been controlling his hypertension and ask specifically about erectile dysfunction related to hypertensive medication. Hypertension is a risk factor for developing other cardiovascular diseases, including stroke. This client has 2 risk factors for developing a stroke: hypertension and his racial background. The nurse should ask all clients about taking OTC preparations when being admitted, but this question would have no bearing on the clients presenting symptoms of a stroke. The client has symptoms of a stroke. Whether he was taking an aspirin to prevent a potential problem is irrelevant. The client has a problem at this time. Green, leafy vegetables are high in vitamin K, the antidote for Coumadin. The client has no reason to be taking an anticoagulant at this time. The 44-year-old female client presents to the emergency department diagnosed with a stroke. Which of the client's current medication regimen is a risk factor for developing a stroke? 1. Propranolol. 2. Furosemide. 3. Estradiol/norgestimate. 4. Metformin. The correct answer is 3. Estradiol/norgestimate. Rationale: propranolol a beta blocker, is administered for cardiac dysrhythmias and hypertension and for migraine headache prophylaxis. The medication could help prevent a stroke by lowering the blood pressure. Furosemide is a loop diuretic. Loop diuretics have an indirect ability to lower the blood pressure by decreasing the volume of fluid in the body. This would decrease the risk of a stroke. Estradiol/norgestimate is a combination hormone used to prevent conception. Combination oral contraceptives have been associated with venous and arterial thromboembolism, pulmonary embolism, myocardial infarction, and thrombotic stroke. Adverse reaction to metformin glucophage, a biguanide, is lactic acid buildup, not stroke.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.